Imagine having a Ferrari but not being able to rev its engine. Sounds frustrating, right? This is the truth for many men dealing with erectile dysfunction, a condition that's not just about the physical, but also deeply impacts the emotional and psychological aspects of a man's life. Now let's take a moment and ponder over this. How often do we hear conversations about men's health issues, particularly erectile dysfunction? Not very often would be the safe guess. That's because it's often viewed as a taboo, a hushed whisper, a secret shared in confidence. But why should it be? It's a health concern, just like any other. Erectile dysfunction is more common than you might think. It's a global concern, affecting millions of men across different age groups, ethnicities, and social backgrounds. It's not confined to the older gentlemen, but can also impact younger men. It's high time we broke the silence and started talking openly about erectile dysfunction. The importance of understanding and discussing men's health issues cannot be overstated. It's not just about the physical discomfort or the emotional distress it causes, but also about the deeper implications it has on a man's overall well-being. Erectile dysfunction is not a death sentence, nor is it a sign of diminished masculinity. It's a health condition that needs understanding, attention, and appropriate care. It's about time we shed the stigma associated with it and embraced it as a part of the larger conversation on men's health. So let's start this journey together, unveiling the truth about men's health. Let's delve deeper into the world of erectile dysfunction, debunk myths, and understand the realities. Because the more we know, the better we can manage, overcome, and even prevent it. Remember, you're not alone in this. There's a whole community out there ready to support, guide, and walk with you through this journey. Erectile dysfunction, a hushed whisper in men's health, deserves more attention and understanding. So what exactly is this silent player erectile dysfunction? Let's dive into the mechanics. Erectile dysfunction, often abbreviated as ED, is a medical condition that affects a man's ability to achieve or maintain an erection suitable for sexual intercourse. It's not a one-off event. We're talking about an ongoing issue that can be a source of stress, affect self-confidence, and contribute to relationship problems. Now, how does this occur? The process of achieving an erection is quite complex and involves the brain, hormones, emotions, nerves, muscles, and blood vessels. If something disrupts any of these elements or the delicate balance between them, it can lead to erectile dysfunction. Let's look at the most common causes. They can be physical, such as heart disease, diabetes, obesity, Parkinson's disease, and tobacco use, or psychological, like stress, anxiety, depression, and relationship problems. Certain medications can also contribute to ED. As for the symptoms, they revolve around sexual performance. This includes trouble getting an erection, difficulty maintaining an erection during sexual activities, and a reduced interest in sex. But how does erectile dysfunction affect a man's life? Well, besides the obvious sexual issues, it can also lead to significant emotional distress. Men may feel embarrassed, guilty, or ashamed, which can lead to avoidance of intimacy and potential strain on relationships. Moreover, erectile dysfunction can also signify underlying health issues. For instance, heart disease and diabetes are often associated with ED, thus it can be a warning sign of more serious health problems. It's important to understand that erectile dysfunction is not a personal failure or something to be ashamed of. It's a medical condition like any other, and it's more common than you might think. Around half of men aged 40 to 70 have some degree of erectile dysfunction, and the prevalence increases with age. Erectile dysfunction is more than just a bedroom issue. It's a health concern that seeps into every aspect of a man's life. How much of what you think you know about erectile dysfunction is actually true? Let's set the record straight and debunk some common myths and misconceptions that swirl around this subject. First on the docket, the idea that erectile dysfunction is just a natural part of aging. While it's true that the likelihood of experiencing erectile dysfunction does increase with age, it is by no means an inevitable fate. Many men remain sexually active well into their golden years. So don't let this myth lead you to accept erectile dysfunction as a foregone conclusion. Next, there's a widespread belief that erectile dysfunction only affects the sexually active. This is a misconception. Erectile dysfunction is a health condition, not a lifestyle outcome. It can affect any man, regardless of his sexual activity or lack thereof. Another common myth is that erectile dysfunction is all in your head. Yes, stress and psychological factors can contribute to erectile dysfunction, but it's not solely a mental issue. It's often a symptom of underlying physical conditions like heart disease, diabetes, or hormonal imbalances. One particularly harmful myth is the notion that if you have erectile dysfunction, your sex life is over. This couldn't be further from the truth. There are many treatments available, from lifestyle changes and medications to therapies and procedures that can help manage the condition and restore sexual function. Finally, there's the misconception that erectile dysfunction doesn't affect anyone but the man experiencing it. The reality is, it can have significant impacts on partners and relationships. Open communication and understanding are crucial in navigating these challenges together. You see, these myths and misconceptions contribute to the stigma and misunderstanding surrounding erectile dysfunction. They can lead to needless worry, prevent men from seeking help, and even exacerbate the problem. Remember, misinformation can be as damaging as the condition itself. So, let's continue to educate ourselves and others, dispel these myths, and bring the reality of erectile dysfunction into the light. Despite the challenges, overcoming erectile dysfunction is not a far-fetched dream. It's a reality that many men have achieved, and you can too. Let's delve into the various treatments and lifestyle changes that can help manage and overcome this condition. One of the most common treatments for erectile dysfunction is medication. Drugs such as sildenafil, tadalafil, and vardenafil work by increasing blood flow to the penis, helping to achieve an erection. These medications are usually effective, but remember, they are not a cure-all. It's essential to have a frank discussion with your healthcare provider about the potential side effects and the right dosage for you. Another option is therapy. Psychological factors such as stress, depression, and anxiety can contribute to erectile dysfunction. Cognitive behavioral therapy and sex therapy can help address these issues, leading to improved sexual performance. Sometimes the solution can be as simple as a lifestyle change. Regular exercise, a healthy diet, and avoiding alcohol, nicotine, and illicit substances can improve overall health and, by extension, sexual health. Additionally, maintaining a healthy weight and managing chronic conditions like diabetes and heart disease can significantly improve erectile function. For those who have tried medications and lifestyle changes without success, there are other treatments available. Vacuum erection devices, penile implants, and vascular surgery are options that can be considered, although they come with their own risks and benefits. Now here's a question for you to ponder. Are you willing to make the necessary changes to overcome this hurdle? Remember, it's not about quick fixes, but a commitment to overall health and well-being. Winning over erectile dysfunction begins with taking the first step towards understanding and acceptance. It's about recognizing the problem and seeking help without shame or fear. The journey may be challenging, but the destination, a fulfilled and healthy sexual life, is worth every step. In our next video, we'll be discussing a topic closely related to men's health, the shocking dangers of low testosterone. Don't miss out on this crucial information, and remember to like, share, and subscribe for more life-changing videos. Now think about this. How much does your testosterone level affect your overall health? It's a question that might not cross your mind often, but it's an important one nonetheless. And it's a question we have to tackle in our next video, delving into the shocking dangers of low testosterone. You see, testosterone doesn't just play a role in men's sexual health. It's also pivotal for maintaining muscle mass, bone density, and even our moods. It's a topic that demands our attention, much like the one we've discussed today. Erectile dysfunction is not a condition to sweep under the rug or bear in silence. It's a common health concern that affects millions of men worldwide, and it's a concern that has solutions that can be managed and overcome. We've explored this today, dispelling myths and shedding light on the truth about men's health. But our exploration doesn't stop here. There are still many facets of men's health left to uncover, and many conversations left to be had. And we want you to be a part of these conversations. We want to continue providing you with the information and the tools to take charge of your health, to live your life fully and confidently. So, if you found value in this video, if it has empowered you with knowledge or comforted you with understanding, then we encourage you to share this video. Share it with your friends, your family, your colleagues. Let's spread this knowledge and spark these important conversations. And if you haven't already, subscribe to our channel, because our journey into men's health is far from over. We've got a wealth of information to share, from tackling low testosterone to understanding prostate health and much more. Don't forget to give this video a like if it resonated with you. Your support means the world to us and helps us continue to bring these topics to light. Don't forget to tune in for our next video where we dove into the shocking dangers of low testosterone. Until then, take care and stay healthy.